Audio Jungle.
Greetings everyone, we are from Apex Greece Fortress.
Our problem statement is some of people in Caloocan City experience migraine including our friends.
And our solution for this is filming an awareness video that contains information about migraine. It also contains a video of the interview with a person who has a migraine. That it will be posted in social media sites.
The definition of migraine. Migraine headache can cause intense, throbbing or pulsing sensation in one area of the head and is commonly accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can cause significant pain for hours to days and be so severe that all of you can think about is finding a dark, quiet place to lie down. Some migraines are preceded or accompanied by sensory warning symptoms, which is usually aura, such as flashes of light, blind spots, or tingling in your arm or leg.
The symptoms of migraine. Migraine headaches often begin in childhood, adolescence, or early adulthood. Migraines may progress through 4 stages, including prodrome, aura, headache, and postdrome. So you may not experience all these stages.
Prodrome. 1 or 2 days before migraine, you may notice subtle changes that signify an oncoming migraine, including constipation, depression, food cravings, hyperactivity, irritability, and laxity.
Attack. When untreated, a migraine usually lasts from 4 to 72 hours, but frequency with which headaches occur varies from person to person. You may have migraine several times a month or much less often. During a migraine, you may experience the following symptoms: pain on one side or both sides of your head, pain that has a pulsating, throbbing quality, sensitivity to light, sounds, and sometimes smells, nausea, and vomiting, blurred vision, lightheadedness, sometimes followed by
Postdrome.
fainting.
The final phase, known as postdrome, occurs after a migraine attack. During this time, you may feel drained and washed out. Lots of people report feeling mildly euphoric.
When to see a doctor? Migraine headaches are often undiagnosed and untreated. If you regularly experience signs and symptoms of migraine attacks, keep a record of your attacks and how you treated them. Then make an appointment with your doctor to discuss your headaches. Even if you have a history of headaches, see your doctor if the pattern changes or your headaches suddenly feel different. See your doctor immediately or go to the emergency room if you have any of the following signs and symptoms which may indicate other more serious medical problems: an abrupt, severe headache like a thunderclap, headache with fever, stiff neck, mental confusion, seizures, double vision weakness, numbness or trouble speaking, headache after a head injury, especially if the headache gets worse, a chronic headache that is worse after coughing, exertion, straining, or a sudden movement, new headache pain if you're older than 60.
Although much about the cause of migraine isn't understood, genetics and environmental factors appear to play a role. Migraines may be caused by changes in the brainstem and its interaction with the trigeminal nerve, which is a major pain pathway. Imbalances in brain chemicals, including serotonin, which helps regulate pain in your nervous system, also may be involved. Researchers continue to study the role of serotonin in migraines. Serotonin levels drop during migraine attacks. This may cause your trigeminal system to release substances called neuropeptides, which travel to your brain's outer covering meninges. The result is a headache.
Migraine headache triggers. Common migraine triggers, which include hormonal changes in women, fluctuations in estrogen seem to trigger headaches in many women with no migraines. Others have an increased tendency to develop migraines during pregnancy or menopause. Foods. Aged cheeses, salty foods, and processed foods may trigger migraines. Skipping meals or fasting also can trigger attacks. Food addictive. The sweetener aspartame and the preservative monosodium glutamate found in many foods may trigger migraines. Drinks. Alcohol, especially wine and highly caffeinated beverages, migraines. Stress. Stress at work or home can cause migraines. Sensory stimuli. Bright lights and sound glare can induce migraines, as can loud sounds. Unusual smells, including perfume, paint thinner, secondhand smoke, and others can trigger migraines in some people. Changes in sleep pattern. Missing sleep or getting too much sleep may trigger migraines in some people, as can jet lag. Physical factors. Intense physical exertion, including sexual activity, may provoke migraines. Changes in the environment. A change of weather or barometric pressure can prompt a migraine.
Risk factors. Several factors make you more prone to having migraine. Family history. Up to 90% of people with migraines have a family history of migraine attacks. If one or both of your parents having migraine, then you have a good chance of having migraine. Age. Migraines can begin at any age. So, most people experience their first migraine during adolescence. By age 40, most people who have migraines have had their first attack.
Complications. Sometimes your efforts to control your pain cause problems doesn't work. Abdominal problems. Certain pain relievers called non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, Motrin IV, and others, may cause abdominal pain, bleeding, ulcers, and other complications, especially if taken in large doses or for a long period of time. Next is overuse headaches. If you take over-the-counter or prescription headache medications more than 10 days, a month for 3 months, or in high doses, you may be setting yourself up for a serious complication known as medication overuse headaches. Next is serotonin syndrome. It's a rare potentially life-threatening condition that occurs when your body has too much serotonin, which is a chemical found in your nervous system. It may occur if you take migraine medications called TRIPTANS and antidepressants known as selective serotonin reuptake inhibitors, or serotonin and norepinephrine reuptake inhibitors. These medications naturally raise serotonin levels. When combined, they cause increased serotonin levels in your system, more than if you were taking one of these medications. Also, some people experience complications from migraine such as chronic migraine. If your migraine lasted for 15 or more days a month for more than 3 months, you had a chronic migraine. Status migrainosus. People with this complication have migraine attacks that last for more than 3 days. Persistent aura without infarction. Usually an aura goes away after the migraine attack. However, some people have an aura that lasts for more than a week after migraine attack has reached. And lastly, migrainous infarction. Some people who have a migraine with aura may have aura-caused symptoms that last longer than 1 hour. This can be a sign of a bleeding in the brain, which is a stroke.
What you can do, write down symptoms you're experiencing, even if they seem unrelated to your migraines. Write down key personal information, including any major stress or recent life changes. Make a list of all medications, vitamins or supplements that you're taking. It's particularly important to list all medications, as well as the dosage you have used to treat your headaches. Take a family member or friend along, if possible. Sometimes it can be difficult to remember all the information provided to you during an appointment. Someone who accompanies you may remember something that you missed or forgot.
What you can do in the meantime, keep a headache diary. A diary can help you and your doctor determine what triggers your migraines. Know when your headache starts, how long they last, and what, if anything, provides relief. Reduce stress, because stress triggers migraine for many people. Try to avoid overly stressful situations or use stress reduction techniques like meditation. Get enough sleep. Aim for a regular sleep schedule and get an adequate amount of sleep.
As in diagnostics, blood tests, your Doctor may order blood tests to test for blood vessel problems, infections in your spinal cord or brain, and toxins in your system. Computerized tomography, or it is called CT scan. A CT scan uses a series of X-rays to create detailed cross-sectional images of your brain. This helps doctors diagnose tumors, infections, brain damage, bleeding in your brain, and other possible medical problems that may be causing your headache. Magnetic resonance imaging, or the MRI. An MRI uses a powerful magnetic field and radio waves to produce detailed images of your brain and blood cells. MRI scans help doctors diagnose tumors, strokes, bleeding in your brain, and other brain and neurological conditions. And lastly, spinal tap, which is also called lumbar puncture. If your doctor suspects an underlying condition such as infections or bleeding in your brain, he or she may recommend a spinal tap or lumbar
Treatments
puncture.
and drugs. Migraines can't be cured, but doctors will work with you to help manage your condition. Medications used to combat migraines fall into two broad categories. First, pain-relieving medications, also known as acute or operative treatment. These types of drugs are taken during migraine attacks and are designed to stop symptoms that have already begun. Second, preventive medication. These types of drugs are taken regularly, often on a daily basis, to reduce the severity or frequency of migraine.
Pain-relieving medications. Pain-relieving medications may help you rest or sleep in a dark room after taking them. Medications include pain relievers, aspirin or non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil, Motrin IV. Others may help relieve mild migraines. Pain relievers, such as acetaminophen, Tylenol, and others, also may help relieve mild migraines in some people. Triptans. Many people with migraine attacks use triptans to treat their migraines. Triptans work by promoting constriction of blood vessels and blocking pain pathways in the brain. Triptans effectively relieve the pain and other symptoms that are associated with migraine. Ergots. Ergotamine and caffeine combination drugs are less effective than triptans. Ergot seems most effective in those whose pain lasts for more than 48 hours. Anti-nausea medications. Because migraines are often accompanied by nausea with or without vomiting. Medications for nausea is appropriate and is usually combined with other medications. Opioid medications. Opioid medications containing narcotics, particularly codeine, are sometimes used to treat migraine headache pain for people who can't take triptans or ergot. GLUCOCORTICOIds, such as PREDNISONE, DEXAMETHASONE. A glucocorticoid may be used in conjunction with other medications to improve pain relief.
Preventive medications can reduce the frequency, severity, and length of migraines and may increase the effectiveness of symptom-relieving medicines used during migraine attacks. To prevent or reduce the frequency of your migraines, take this medication as your doctor recommends. Cardiovascular drugs, beta blockers, which are commonly used to treat high blood pressure and coronary artery disease, may reduce the frequency and severity of migraines. If you're older than age 60, use tobacco or certain heart or blood vessel conditions. Doctors may recommend you take alternate medication instead of beta blockers. Next is antidepressants. Certain antidepressants help to prevent some types of headaches, including migraines. Tricyclic antidepressants may be effective in preventing migraines. Note that you don't have to have depression to benefit from these drugs. And next is anti-seizure drugs. Some anti-seizure drugs, such as valproate sodium, which is the backbone of this and topiramate, also called as Topamax, seem to reduce the frequency of migraine headaches in high doses. However, these anti-seizure drugs may cause side effects. And next is toxin A, also called as Botox. It has been shown to be helpful. During this procedure, injections are made in muscles of the forehead and neck. When this is effective, the treatment usually needs to be repeated every 12 weeks or usually 4 months or 2. Pain relievers. Taking non-steroidal anti-inflammatory drugs, especially naproxen, also called as
lifestyle. Self-care measures can help ease the pain of a migraine headache. Try muscle relaxation exercises. Relaxation may help ease the pain of a migraine headache. Relaxation techniques may include progressive muscle relaxation, meditation, or yoga. Get enough sleep, but don't oversleep. Get an adequate amount of sleep each night. It's best to go to bed and wake up at regular times as well. Rest and relax. If possible, rest in a dark, quiet room with the feel a headache coming on. Place an iron strap wrapped in a cloth on the back of your neck and apply gentle pressure to painful or areas on your scalp. Keep a headache diary. Continue keeping your headache diary even after you see your doctor. It will help you learn more about what triggers your migraines and what treatment is most effective.
Non-traditional therapies may be helpful if you have chronic migraine pain. First is acupuncture. In this treatment, a practitioner inserts many thin disposal needles into several areas of your skin at defined points. Clinical trials have found that acupuncture may be helpful for headache pain. Next is biofeedback. Biofeedback appears to be effective in relieving migraine pain. This relaxation technique uses special equipment to teach you how to monitor and control certain physical responses related to stress such as muscle tension. Next is massage therapy. It may help reduce the frequency of migraines. Researchers continue to study the effectiveness of massage therapy in preventing migraines. Next is cognitive behavioral therapy. It may benefit some people with migraines. Lastly, herbs, vitamins, and minerals. There is some evidence that the herb butterbeer may prevent migraines or reduce their severity. Another herb, feverview, may help prevent migraines, but it has shown mixed results in studies. A high dose of riboflavin, which is vitamin B2, also may prevent migraines or reduce the frequency of headaches. Coenzyme Q10 supplements may decrease the frequency of migraine, but they have little effect on the severity of the headache due to low magnesium levels. In some people with migraines, magnesium supplements have been used to treat migraines, but with mixed results.
Good morning, Mr. Valentin. Could I interview you about migraine for a while? Sure. Do you have a migraine? Yes. Is it attained or genetic? It is genetic. Actually, I got it from my mother. What does it feel when you are encountering a migraine attack? It feels like someone is slamming a hammer on your head. What did you do to relieve from the pain that you felt? Painkillers should do the job, and white flour, a lot of white flour. Do you know different things that can trigger migraine? Yes. Strange smell. Too much rocking of the head and stressing yourself too much could trigger it. Alright, that's all. Thank you for answering the questions that I asked. You're welcome.